So I would like to now introduce our Executive Director of Operation Catnip, Shaye Olmstead. Shaye's been running these clinics for the past few years and was a volunteer long before that. Our monthly clinics are designed to deal with cats that are not in the shelter system. They are cats that would reproduce and produce kittens that might come into the shelter system. And so it's an intake prevention strategy, so proactive intake prevention strategy. But we do have cats that are still coming to the shelter, and we need to deal with them as well. And you've heard a lot of talks today about how strategies that different shelters have designed to deal with the cats that are already in the shelter. And Shaye has developed an amazing program to deal with that aspect of our community cats as well, in an effort to serve all of the cats in our community. So I'd like to introduce Ms. Shaye Olmstead.
All right, so first I'd like to paint a picture of two Florida shelters and the disparities of those two populations. This is probably the one on the left, quite a familiar live release versus euthanasia rate to a lot of your communities. I'm going to turn this portion back over to Julie because she's a little bit more familiar with the data.
So apparently I switched up the slides for Shaye, and she's kind of wondering what she's looking at. But she's going to tell us how we make this work. So one thing we've all looked at is how much money has been invested in taking in cats, holding them for a while, adopting some out, but euthanizing most of them. And it is very, very expensive to do that and to run animal shelters. And so what if we took all of that money and invested it alternatively in programs that actually help the cats, help protect the environment, help protect public health in our communities as well. This shows a decrease in cat euthanasia at our local shelter. And years ago, in 1994, we're euthanizing over 4,000 cats a year. And we've implemented a lot of programs that you can see incrementally has decreased the number of cats that are euthanized in our community. And so we started in 1998 our Operation Catnip program, which was very important with starting to just stop cats from coming into the shelter in the first place. Maddie's Fund kicked us off with a community collaboration grant that brought our shelter, the Spay-Neuter clinic, and our local rescue groups together with a commitment to incrementally reduce the number of animals that were being euthanized in our shelter. Has anyone been involved in a Maddie's Community project before? So you know they hold your nose to the grindstone pretty tightly. They give you milestones to meet and constantly threaten to take your money away if you don't meet those milestones. So everybody gets really motivated to put their issues aside and work together to save lives in our community. It was an amazing process for ours, and the grant is over. It was a 10-year project, but our community groups are very used to working together productively to save animals, and it's a culture. We have no drama in our community anymore, and I see all of the fighting that is taking away from saving lives in other communities is just not productive. So we were very grateful to Maddie's Fund for funding that. And then we started a shelter medicine program at the University of Florida, and this allows the rescue groups to bring their pets to UF to be spayed and neutered, most of them for free. That's funded by Marielle and PetSmart charities. So the vet students are also getting all engaged in this and learning about the problems of homeless animals. And then there's Maddie's Shelter Medicine Program. So that's who I work with now. This program started in 2008. There's 3 faculty, residents, interns. We have a consultation service for shelters. We do disease outbreak intervention, a lot of research, and we employ a lot of our effort in our local community as well, helping the rescue groups and the animal shelters. And then our Humane Alliance Model Spay-Neuter Clinic, Operation Catnip, opened up in 2009, and so that was the missing piece that we'd had for a long time, is we did not have a way to do large-scale spay-neuter for animals other than feral cats. And then finally, our Humane Society, which used to have a storefront, opened a large, full-service animal shelter and was able to humanely house animals and get them adopted out. And they do most of their intake is from our county animal shelter. And so we're really proud of that decrease in euthanasia and what it's done, but we also keep track of who's still dying in our shelter. And this is data from a couple years ago. We looked at just the total euthanasia list, analyzed them by what risk group they were in. And what we see is, not surprisingly, because we see this everywhere, is that it's adult cats. And it's usually stray adult cats that are dying in the highest numbers in our shelter. They just outstrip the ability of shelters to deal with these. And in that year, 928 of the cats of the deaths were these adult cats. So that just tells us, where do we need to put our resources and our effort right now to have the biggest impact? Aggressive cats, we could work on them, but that's only going to save like 10 cats in our community or something. But we could save almost 1,000 if we dealt with these healthy adult cats. So we were wondering, we're doing everything we can. Like, how could we save more cats? Our rescue groups are full, as you know. Rescue group transfer is never going to be a big, high-volume solution to cats. The rescue groups are much more effective in dog transfers and helping euthanasia rates that way compared to the cats. So we know that pushing them out to rescue is not going to be possible. Our shelter adoptions had plateaued. They weren't going up, so that didn't seem like a way we could really move the table. Transport programs won't take cats. Occasionally, the folks in Miami actually found a shelter in Maine. Could you go farther? I guess you could go to Seattle. Pardon? What? Maryland. Okay, Maryland. Well, not so far then. So anyway, they're taking them from Miami up north, and a sizable number, too, in these big transports. But I think that's the only shelter in the whole country that will take large numbers of cats, and it's taken. So transport program is not going to be our big-scale solution like it is for dogs. We are already really good at mitigating nuisance complaints. These are the animal control, when they get a complaint about cats, calls Shaye. Shaye deals with the people and tries to solve their problem without impounding the cat. And it is truly amazing, and Shaye can share some of the stories and solutions that she uses. If you tell people what's likely to happen at the shelter and then help them find a different solution that deals with the problem they're having, most people will meet us more than halfway. They want to know that they're heard. You can talk them off the ledge and say, try this and that, and we will get them neutered, which fixes most of their complaints. And then if that doesn't work, in 2 weeks we'll be back, and we'll follow up on this so they don't feel abandoned. And by and far, most of the time, we can divert the intake if we can get them before they're at the shelter. And then our litter prevention program, our monthly clinics are going strong. So what else could we possibly do? Is this where?
Thank you, Julie.
Okay,
so so like Dr. Levy was just talking about, we obviously have a very vibrant animal welfare community. We're very, very lucky in Gainesville that we had the opportunity to spend 10 years practicing life-saving through the Maddie's project, but really had exhausted the rescue group capacity for adoptable cats. I started managing the Operation Catnip Spay and Neuter program in 2008 and was also volunteering with one of the Maddie's Coalition partner rescue groups. So I was seeing the euthanasia list every day for several years before our Shelter-Neuter Return program started, and was very much aware of the fact that the cats that our programs were neglecting were adult, stray intake type cats primarily. And the sad thing was that most of them were thriving where they were. They had just been unfortunate enough to have been intaked at our county shelter. And due to usually space or time, we're not able to be dispositioned into homes. We, through the Maddie's Outdoor Cat Project, 2006 to 2008, we did a targeted zip code spay neuter project at Operation Catnip, and we worked really closely with our county shelter. We had someone in the shelter daily getting intake data and assessing free-roaming cats in the shelter. And at that time, we really started pulling already ear-tipped cats that had been through our program. We call them Operation Catnip graduates, and placing them back in their outdoor homes if they were thriving and in good condition. This was something like 75 to 100 cats a year that were already ear-tipped coming into our county animal services that we were pulling and putting back. More often than not, no nuisance complaints really needed to be mitigated. We just needed to educate people on what happens to, adult cats in our shelter. Most people thought that they were being good Samaritans and taking steps to find friendly stray cats homes. Occasionally it was, feral cats with nuisance complaints attached to them. Oh, this cat's peeing on my truck tires, or I have a neighbor that's feeding and, they're killing birds in my yard. But more often than not, it was just a lack of information that landed these cats in the shelter. And so they were largely able to go back to where they came from. Relocation is always a last resort, and the smallest percentage of animals that we handle from the shelter are relocated. Working closely with the shelter for about 3.5 years, pulling Operation Catnip graduates, we had developed a real relationship with the animal control officers. Even though education in the field is not really their specialty, they just don't have enough officers on the ground to be able to spend the time to really educate the public about free-roaming cat issues. We've developed a really good rapport with the ACOs, and the ACOs would often contact us from the field and ask us to step in and educate members of the community about our TNR program and about different tools that could be used to either keep cats off their property or find homes for cats on their own, that sort of thing. Although it was still, a kind of inconsistent, an unofficial sort of program. So we were in the shelter, every week pulling these ear-tipped cats, and the ACOs finally said, why not take all of the feral cats? Why not, take these other strays? Why just the ones that are already neutered? Isn't it possible that your program can help these other cats? And so in the fall of 2011, Best Friends Animal Society gave us a grant to pilot this project. And we started out thinking that of the almost 1,000 cats a year that were being euthanized still in our county, about half of those were being evaluated as feral. And so we set out to save 400 of those cats. The response from our county animal shelter for this program was overwhelming. They were extremely supportive of us getting the cats out alive and getting them spayed and neutered and returning them to their outdoor homes. While we did get a handful of complaint calls, we were able to mitigate most of those just by educating people in the community who were complainants or good Samaritans who just didn't understand the system. And most of the cats that we pulled that fall and spring were able to return to their outdoor homes. So it began with just a few cats. And as animal control saw the possibility and our relationship built, we were able to save 911 cats in 2012. So who qualifies? Cats that are thriving in their outdoor homes, if they're in good body condition. Adult cats primarily. We will TNR juveniles, 12 weeks and over, preferably more like 4 to 5 months. But if they're really feral and if they seem to have caregivers and a community that will continue to support them, since those first few months of life are the most fragile for them. So no cats that are under any imminent threat. We try to get as much intel as we can before replacing cats back where they came from. Fortunately, our program coordination staff spends a lot of time talking to caregivers in the community. We have a huge database of caregivers and colony information. For the approximately 40,000 cats that we've worked with over the last 15 years, we have data for all of them as to where they came from and who brought them in. And so we sort of have this tribal knowledge about places in town where there are caregivers and places in town that are more cat-friendly than others. And so if we're unfamiliar with an area, then we'll go ahead and call a complainant or the finder of the cat and try to get some more information and make sure that it's a good situation for them. But more often than not, it's a familiar area. We know that cats are being fed nearby, and so the cats are pulled from our county shelter, sterilized, and returned. Unfortunately, the program is reactive, so these cats are already in the shelter environment, and our county requires a 3-day stray hold still. Shelter-acquired disease is a huge problem. We end up having to hold and treat lots of cats for upper respiratory infections, which is a bottleneck in our program and is also a huge expense. We would like to move towards a more proactive program like they have here in Jacksonville, where we could get cats before they enter the shelter, but it would take an ordinance change, and our community just isn't there yet. But we do have a lot of support, both from the county and the animal control, to carry out this program regardless. So, our goal is to help as many cats as we can and trying not to hurt the rest. So this gives you an idea of the trends in cat intake and euthanasia, and some of those big dips were the programs that Dr. Levy talked about earlier, the shelter medicine program, the Humane Society opening their doors to their new shelter, Operation Catnip, et cetera. But you see the most significant drop in cat euthanasia, and where intake and euthanasia divert to the most extreme is when that Shelter-Neuter Return program really kicked into high gear in 2012. So last year we were able to report an unheard of 87% live release rate for cats. Alachua County is now the safest place to be a cat. So there are 3 paths for cats coming through the shelter. Adoption, if there's adoption capacity, and one of the things that we've had to do throughout this program is really beef up our relationships with transfer partners. So rescue groups that have adoption facilities, because we never intended to be an adoption program, and certainly evaluation of behavior for cats in the shelter is inconsistent. So a lot of times we would get cats that seemed like good TNR candidates, and then while we were treating them for URI or just in the process of processing them through spay and neuter, we found that these would really be great candidates for adoption, or in the process of getting intel as far as where the cats need to go back to. Maybe we found that they didn't have a caregiver, or they didn't have stable care, or had some other kind of volatility in their environment. And so, we try to track those cats for adoption. Rescue groups are pretty happy to take them if we can spay and neuter them for them first, so that certainly helps. But, we really want to target our efforts to the cats that are, going to be tracked for return to the environment. So shelter, neuter, and return, and then euthanasia. So only the cats that can't be placed into a home and that aren't thriving in the community. So, if extremely geriatric cats that are socialized, that have issues like stomatitis, if they need, have advanced dental disease and are going to need, surgery, that sort of thing, like those cats would get tracked for an adoption program. We wouldn't consider placing those cats, back out in the environment. So only cats that are thriving. And what we find is, by and large, most of them are doing just fine. Most of them have no trouble finding their next meal, and are fat and sassy and happy. So, as I said, our program is reactive, and we're still, learning a lot of lessons about movement of animals through the program, ways of trying to divert cats from ever entering the shelter in the first place. Unfortunately, since we're not the first responders, we don't have the luxury of being able to have that educational conversation with the public up front. So we rely on building our relationship with the ACOs so that they're deploying some of the same helpful information and tools, and just ask that, if possible, before intaking cats, we have an opportunity to talk to people in the community. Certainly being able to offer the monthly spay day clinics as an alternative to sending the cats to the shelter, asking people to give cats a second chance and see how things go after they're sterilized, is often, placative, and once the cats are fixed and they're no longer spraying and reproducing, the complaints in the community diminish. The reactive type of shelter-neuter return program is very expensive, so if it's possible in your community to get cats before they enter the shelter, that would be ideal, and that's certainly the direction that we're moving towards. We're just not there yet, but it's a very new program, just starting in the fall of 2011, so we still have a lot to learn, but the success was really surprising and overwhelming, I think, to all of us, but we really owe it to the collaboration with our animal control. So developing that relationship really was key to the success of this program. All right.